The sebaceous glands are oil glands, and they secrete oil or sebum, which is actually a bunch of crud. It's a mixture of fats, including triglycerides and cholesterol, proteins, electrolytes, and this sebum is going to coat the hair shaft, and it's going to ooze out onto the surrounding skin, providing lubrication. It has antibacterial properties. It keeps the hair shaft from becoming brittle, and it squeezes out when that erector pili muscle contracts. We also secrete sebum onto the skin surface on the face, the back, the chest, the nipples, and the external genitalia. The sweat gland, there are two different kinds of sweat gland: apocrine sweat gland and merocrine sweat gland. So the apocrine, think of ape. This is the type of sweat gland that produces an odor in the armpits, the pubic region. It is, the substance is secreted, and it is used by the bacteria on the skin to produce an odor. Merocrine sweat glands are for thermoregulation. All over the body, they produce a watery secretion with electrolytes, and that helps keep us cool. Which of the following is involved in thermoregulation? Apocrine glands. Which of the following is associated with the hair follicle? The duct of the sebaceous or oil gland. Our nails protect the tips of our fingers and toes. The nail body is thick sheets of dead, keratinized epidermal cells. The nail bed is an area of the epidermis under the nail body. Nail production occurs at the nail root. The cuticle is part of the stratum corneum, the outer layer of the epidermis that extends over the nail root. And the half moon shape near the nail root is the lunula. You have lunulas on your fingertips. Health conditions can change the nail appearance. They may be pitted. They may have ridges, and some of these nail changes are the sign of specific disorders. Which of the following is not associated with keratin? Puncture resistance of the dermis. So there are definitely age-related changes in the integument. Fewer melanocytes, drier epidermis, thinning epidermis as that fat distribution underneath the skin, that fat distribution changes. Fewer active hair follicles, slower repair, reduced blood supply, decreased perspiration, thinner dermis, and a poor immune response. Repair of the skin. So this picture on the upper left is a picture of a capillary that has lost a few red blood cells, and on the lower picture you can see red blood cells trapped in fibrin threads to form a blood clot. So the initial injury to the skin causes bleeding, and the mast cells secretes products, histamine and heparin. After several hours, a blood clot or scab will form at the surface. The cells of the stratum basale will migrate along the wound edges. Macrophages remove debris. And if the damage is into the dermis, fibroblasts will come in and help with the blood clot formation and a type of tissue called granulation tissue forms. This is the kind of, it's delicate pink. This is what you see on your skin if you pull off a scab too early. That's the granulation tissue. After 1 week, the scab is undermined by migrating epidermal cells. The blood clot disintegrates. If the wound is large, you've got the fibroblasts forming too much collagen fiber, too many collagen fibers. This scar tissue is different from regular skin. It's inflexible, and it doesn't respond the same as skin. It doesn't tan like skin. You can pause this slide to read through it. So sometimes stitches are not required, but it may cause the wound to heal faster, and it reduces the risk of infection to have stitches. Some scar tissue forms abnormally. The scar tissue, this type of scarring is called a keloid, and it's just a raised, thickened mass of scar tissue. Which of the following is found in granulation tissue? Capillaries. Which of the following will be stimulated by an increased blood supply? Sweat gland secretion. Oh, those are the cells that stimulate the immune system to resist infection. Which cells provide protection against UV radiation? Melanocytes producing the melanin. What product of the skin is involved in maintaining bone health? Vitamin D. Which of the following is stimulated by damage to the dermis? Fibroblasts. Which of the following drugs can be absorbed from a transdermal patch through the skin? Hydrocortisone, a steroidal anti-inflammatory drug. What cells are responsible for removing debris from damaged skin? Macrophages.